welcome back to another episode of AIBiZ. I'm your host Avik, and today we are diving into a topic that's reshaping the healthcare as we know it: AI in medicine. Yes, you heard that correct. AI in medicine. So, now let's be honest, dear listeners. AI in the healthcare often brings up the big questions like, will algorithm replace doctors? Can we trust AI to guide life or death decisions? Or is this the feature that we are ready for, or something that we should fear? I guess most of you have thought about something like this, right? But what if the real potential of AI isn't about replacing the humans at all, but empowering them, helping clinicians make better decisions, reduce the burnout, and care for patients with more humanity, not less? Yes. So today's guest is the very heart of the conversation. Meet Dr. Bhargav Patel. So welcome to the show, Dr. Bhargav.
Thank you for having me, Avik.
Lovely, amazing. So, dear listeners, before we delve deep into the conversation, I'll quickly love to introduce you with Dr. Bhargav. Dr. Bhargav is a physician, innovator, author, entrepreneur, and the medical director and director of AI clinician support at Sully.ai, a revolutionary platform used by over 10,000 clinicians across tens of millions of patients visits every year. So he's also the co-founder and CEO of MyPeak, an award-winning vegan health company, and somehow amidst all that, he's publishing a book on trauma, resilience, and healing called Trauma Transformed. So, Dr. Patel is here to unpack how AI is already transforming healthcare, what agentic AI means for physicians and the patients, and where he sees the future heading with the insights, nuance, and a deep commitment to keeping healthcare human. So, I'll not take much of your time, dear listeners. Let's jump in and welcome to the show again, Dr. Patel.
Thank you. I'm excited to jump right in.
Lovely, lovely. So, Dr. Patel, first of all, I mean, it's really incredible, like how many worlds you are weaving together, like psychiatry, AI, entrepreneurship, wellness. It's huge. So, um, when did you first realize that AI wasn't just a kind of tech trend, but something that could fundamentally change the healthcare?
That's a fantastic question. I think we've been hearing hype about AI for a long time, even into the early 2000s. And then there's been seminal developments like AlphaGo and
Mm,
other steps along the way. But really, the moment that changed it for healthcare, and really for me, was with the release of GPT-3 around 2021. For the first time, you saw the ability of AI with natural language processing to really communicate the way a human does and process massive amounts of information in a
mm,
transformative way. And I think that was really the moment that I was like, AI really has a chance to make a huge difference in healthcare, not later, not
mhm.
20 years from now, but right now.
Perfect, perfect. And like if I have to say this way, like what drew you personally to focus on the clinician support, like rather than the direct patient facing the AI tools?
I think with the hype around AI, some technologists will say AI is going to replace physicians. I think that's incredibly unlikely. I think especially anytime soon, I think we vastly underestimate how much people appreciate human connection
Mm,
and want a human there. A classic analogy I use is how many of us would want to board a plane without a pilot on it? Not many of us. Even though even today AI and autopilot flies about 95% of the flight, we still don't
mhm,
want to board a plane without a pilot on it. And I think it's the same with healthcare. It's a high risk, high stakes situation where we want the
mm,
physician in the loop. And so I really see that as how we go forward. And that's why I decided to focus on clinician support and helping doctors by cutting down admin burden, reducing administrative time. The number one cause of burnout for physicians today, if you look at the studies and the research, is
mhm,
is the admin burden. It's all the notes, it's all the billing, coding, all the stuff that doctors didn't go to medical school for. They went to medical school to help patients, not to write notes and be administrators. So I think when we take that stuff away, we really help the physicians provide better patient care, make less errors, be less overloaded, and reduce burnout, which lets them ultimately focus on the person in front of them, the patient. It lets them make eye contact with the patient rather than be worried about writing their notes. And overall, it makes life better for both physicians and patients.
Okay, okay. Understood. That's quite interesting. Yeah. I mean, that's a um powerful distinction. I think many people imagine that AI as something replacing the doctor, but you're showing like how it can be a partner to the doctor, not as a substitute. So that's very important. Yeah. And also, if you can share about Sully.ai, which is already being used in tens of millions of patient visits. So, for the listeners like who aren't familiar, what exactly it do and how does it support doctors in real time?
Absolutely. So Sully.ai is a agentic AI platform. So what that means is we have a series of AI agents that perform different tasks for physicians. Our goal is to have work basically end to end. So we start with the beginning of the admin stuff physicians need to do and go all the way to the end. So we have a receptionist agent that can schedule patients, take phone calls, record down messages, so physicians can reduce admin burden on that regard. We have a scribe agent, which will listen to the physician and patient encounter and help scribe the notes after with great quality. Also have clinician support, which helps them throughout the visit. We have a research agent. So if you're a physician and you need to look something up, the research agent can do that research for you and help you
Mm,
uh, give the right medications or right treatment or whatever you need to research. Similarly to how a physician would previously use a platform like Up to Date and go search it, instead, the research agent can do that searching and provide you the information right there much faster than it would have taken to go read something in Up to Date or another platform. And so we have a series of enterprise grade AI agents that are meant to help physicians and clinicians across the board all throughout their admin journey and reduce that so they can focus on the patients. And Sully AI launched in 2023 and has scaled tremendously since then. We just raised a Series A round of 15 million back in January, valuing the company at 75 million, and we're continuing to scale from there.
wow, that's amazing. And also, like, any story or example you can share where AI made a measurable difference in clinical decision making.
So, a big thing you're looking at when you're a physician in the room with
Mm,
the patient, you have to write the note afterwards. You have to speak to the patient, you're gathering information, and you're
mm,
essentially crunching that data within your own brain, matching it with patterns. You know, those are some of the things
mm,
AI is really good at. As we currently already know, for
mm,
example, in the US, the licensing exam that doctors take is called the USMLE, the United
mm,
States Medical Licensing Exam. And AI has outperformed most physicians on that exam consistently scores around 90%, 90th percentile, depending on the current large language models. Now, our
mm,
doctor large language model at Sully AI was recently tested and does better than all of the large language models out there, including ChatGPT 4.5, Claude, Gemini, all of the large language models. Our model proved superior performance in medical reasoning, in overall score, and all the categories. And so that platform, that Dr. Large Language Model is being used across all our agents. So they have the best information available out there today.
mm. Okay, okay. Amazing. So, okay, and like, how do I say? Uh, it's you use agentic AI to describe a new way AI can function in the healthcare. So, for the listeners, if you can break down what it means and how it is different from the traditional AI tools.
Absolutely. So agentic AI is,
Mm-hmm.
like I mentioned, it's creating essentially an agent to do a specific task. So that AI is optimized. So you have a general, I think most people today have already used things like ChatGPT at least once. experienced it. And so that's a general large language model. You can ask it questions, ask it to help you with tasks, but it's generally trained. And so it's not specified for specific tasks. Agentic AI takes general large language models or other things similar and trains them specifically for an area. It fine tunes them, it
Mm.
gives them the clear instructions and everything they need to perform in an individual area so they can function autonomously. So rather than just a general AI, you're getting a specific agent to do a specific thing, such as our receptionist agent. It is trained on everything that needs to be done to be a receptionist for a medical office. It can answer phone calls, it can return phone calls, it can speak to patients that call, respond to messages, book appointments, schedule things. And this is different from the old chatbots and things that we used to see years ago. And, you all almost always end up needing a human at the end of it. You're like, "Okay, can I speak to a human?" But these are getting better
Mhm.
and better to the point where they can pretty much do everything and cut out 50 to 90% of the work. And so that reduces costs for a practice. That also reduces or increases efficiency. And so that's what an agentic AI really means. It's creating agents across different areas that are specially trained for that and can perform that task eventually completely autonomously, saving massive amounts of time.
Exactly. Yeah. And like, what are the biggest practical challenges in creating agentic AI, if you say?
So, specifically in healthcare, the
Uh,
bigger challenges are the fact that there's so many different clinical workflows. So, every practice works a little bit differently. If you go to different doctors, they all function
mm,
a little bit differently. So, it's really getting that AI trained specifically to be able to handle a broad range of tasks and be able to adapt to what is necessary in different situations.
mm,
And that training is ongoing, but that is the greatest challenge, I believe, in healthcare because every practice has a different workflow. They want things done in a different specific way. And so if you have 1,000 doctor's offices, it's not one workflow, it's 1,000 different workflows.
mm.
Training agents to be able to handle that broad array of tasks is one of the bigger challenges.
Yeah. Yeah. Got it. Mm. And looking ahead, where do you see the healthcare going with AI in the next 5 to 10 years? What excites you the most?
That's actually one of the most exciting questions to answer. I think AI is going to transform healthcare. I actually think the two biggest industries that will be revolutionized by AI over the next 10 to 15-year time run is healthcare
Okay.
and education. But we're here to speak about healthcare, so I'll focus on healthcare.
Mhm.
And in healthcare, so this is already happening, but I believe within 10 years, every healthcare organization will be using some form of AI tool that helps minimize admin burden as well as writes the notes for the physicians and also helps with what's called clinical decision support. So it's going to reduce errors that physicians make. One of the leading causes of death around the world is actually medical errors because medicine is a very complex and high stakes thing, and humans are imperfect, as is AI, but together they can catch errors that would have been overlooked and save tons of patients' lives. So I think every healthcare organization really around the world within the next 15 years will have adopted AI that helps reduce admin burden, prevent errors, save lives, and make things better for both physicians and patients.
Wow. So, okay, and also, like, if a clinician or a healthcare leader is listening and feeling overwhelmed by AI's rapid evolution, what's the one mindset you would recommend?
I think especially for healthcare leaders, healthcare adopts things a little bit more slowly than other fields. For example, tech is very fast to adopt new technologies. Healthcare moves slower and for good reason, right? There are more risks
Mm,
involved, there's patients' lives involved. So it takes often a more conservative approach, and that's okay. It's
mm,
okay to be patient and feel like you're not feel like you're missing out on that hype cycle of technology where you feel like,
mm,
"Oh, everyone's adopting this thing." It's okay to take your time and really evaluate the better tools because some may be more immediately available, but that doesn't make them the best tools.
mm.
Um, and so it's okay to take the time, do pilots, and really figure out which tool is best for your providers and your practice.
Yeah, exactly. And wow. And like, Beyond AI, you are also deeply invested in the mental health, the resilience, healing, especially through your upcoming book, Trauma Transformed. So, what has your work with trauma and psychiatry influenced the way you approach AI and the innovation?
Absolutely. I think that's a great question. I think one big thing is
Okay.
working with something as sensitive and deep as trauma and psychiatry. We work with people's inner worlds and inner lives, and it's taught me the importance of human connection even as we adopt AI. The goal should be AI that helps
Mhm.
increase human connection, not AI that replaces it, which is something we're already struggling with technology getting in the way of human connection and an epidemic of loneliness around the world, and especially in the modern industrialized world. So we need to make sure as we build these tools, we build them ethically, we build them mindfully, we implement them mindfully. It's taught me that that's what's crucial to AI being most successful is it complementing human connection, enhancing human connection rather than replacing it. And that's one of the core things my work in psychiatry really has influenced my perception of what AI can do for physicians, but not only physicians, but across all industries.
Okay, okay, got it. Huh, amazing. So, and do you see parallels between healing trauma and transforming healthcare systems?
I think absolutely.
Hmm.
Transforming they're different industries, and obviously they
Okay.
work in different ways. Healing trauma works at a very intimate, personal level
Mhm.
with processing the things that are going on in someone's mind, body, emotions, and
Mm,
soul. And that requires facing it. That requires understanding like what things are buried inside, what things have been trapped
mhm.
based on traumatic experiences.
Yeah.
And it can be a complex and messy journey, but I think that's no different from even transforming healthcare. It's a complex and messy journey. We've come up with so many innovations over time that initially seemed like a magic solution, ended up sometimes creating more problems than benefits, or other times created benefits, but also had significant challenges.
Mm,
Classic example is like the electronic health record. It was regarded as revolutionary. Yes, we can now share patient records. We'd have clean records that other clinicians could read. But then we ran into the challenges of interoperability. Every place has their own electronic medical records. It's not shared across the healthcare system. That's also one of the number one reasons for clinician burnout today. So we ran into those challenges. So no matter what with technologies, including I consider medications, drugs, and other things as technologies. So, including how you treat trauma, you can treat it with medications, you can treat it with various technological solutions, as well as healthcare. You can treat it with technological solutions. However, the challenge with that is if you leave out the human component, you're going to miss out on the full potential of healing or transformation, both within trauma and healthcare.
mm. Yeah, okay, true, exactly. So, I mean, what an eye-opening conversation, Dr. Patel. Thank you so much for bringing not just your expertise, but your heart and vision to this dialogue. And uh, for those who are listening, AI in healthcare isn't just the future, it's already here. And Dr. Patel shared that today I mean, it's the greatest power that might lie in making medicine more human, not less. So, yeah, dear listeners, you can learn more about Sully.ai, Dr. Patel's work, and his upcoming book, Trauma Transformed, in the show notes. I'll put all the links in there. And this is your host, Avik, signing off, reminding you that the future of health isn't about the machines replacing us, but it's all about technology helping us show up better, wiser, and more compassionate for each other. So, with this hope, stay curious, stay hopeful, and as always, stay well. Thank you so much.
Thank you, Avik.